Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are talking about innovation in cardiac technology. Joining us today, we have Charles Bruxelle, Cardiology Care Pathways, VP and GM at GE HealthCare. Thank you so much for joining us today.
Thank you, Melanie, for having me.
All right, so we're going to talk a little bit about what are some of the challenges that you all are uniquely placed to help organizations and physicians with.
Yes, so we are still past COVID, and a lot of hospitals, care pathways are really disorganized. So we can see that now that the patients are coming back, volumes are going up. But unfortunately, we still have a lot of issues that we see with our partners, and hospital systems where staffs are short. The amount of data is pretty big, and it's a challenge to be able to use the data. We want to use more and more data, more precise data. Difficult to get it organized, and difficult to have the right people look at it. So at GE HealthCare, we have a really wide portfolio. But on top of that, we are trying to get everything together so that we can make it much easier for the healthcare professionals. And we'll probably talk a little bit later about AI, but that's potentially, technologies we want to develop even more. That's how we can really help, and how we want to help to support our communities and to be able to drive better care for patients.
Yeah, let's delve into AI because, when we're talking, especially at our meetings and talking with our physicians, there is so much information and so much data, and that's a good thing. Yes. But knowing what to do with it, knowing how to keep it secure, so AI is one way that you all are utilizing that safely.
Yeah, you can kind of prepare, so you can segment information so that you can really focus where you want to look at. In all those information, you have a lot of information you don't really need to look at. So how can we use all those technologies so that right away physicians or healthcare professionals can really focus on the right part of the data and be also able to transfer it. Otherwise you spend too much time reviewing things that are not really making a difference. So that's what we are doing, and how can we combine all those information, multimodalities, image fusion, decision making, reporting. That's also another place where more and more we have to report. It's more and more work. You spend less time in front of the patients, and I think that's where you make a difference. So how can we get back to those kind of basics? And data is key. That's how you drive better efficiencies and also how you measure, but it can be overwhelming. And in terms of decision making, we talk about staff shortage. If you are able to have technologies that help you come closer or elevate your team so that they can help you, diagnose those patients for decision making, it's making a big difference. So, our mission is to develop a world where healthcare has no limit, and AI can really be a powerful set of technologies to reach our goals and provide better patient care. That's where we all rally around: healthcare professional companies, especially GE HealthCare, especially in cardiology.
Yeah, when you talk about AI, it's almost like if you don't jump on the train, you're going to be left behind, and that train is moving very fast.
Yeah.
Tell us more about GE HealthCare's enhanced focus on the cardiology care pathway.
We have been very serious about cardiology for a long time, and it has not changed.
Yeah, nothing new for you, yeah.
But we keep pushing. We want to keep developing better technologies and to make it easier for the patients so they have, better experience, but also for the physicians so that they can treat them better. And also trying to move, the care pathway maybe a little bit more upstream. How can we diagnose sooner? Because if you are able to diagnose sooner, maybe you can change the lifestyle and avoid, intervention. There was a really good talk yesterday about lifestyle and focusing on that to be able to reduce cost. I think that's probably the future, but to be able to do that, you need to detect, much sooner, and to be able to intervene on the care pathway much sooner than probably what we do today.
And that information is out there.
Yes.
It's just a matter of organizing it and making sure that you're using it effectively.
Yep.
Yeah, let's talk a little bit about innovation when it comes to advancing cardiovascular care.
Yeah, so AI is big, we'll talk more about this, but we focus on precision imaging. When you look at all the therapies, advanced structural heart, even PCI, you need to be more precise. You want to deliver better care for those complex patients. Patients are becoming more and more complex. And that's where we provide, good technologies. If you look at, what we can provide in terms of CT technologies, you will be able to see that, now we can health physician, but also radiologists to do more patients every day. So then, you can diagnose faster and you can bring them to the cath lab if you need to much faster, with better information. So once you are in the cath lab, you don't have to redo all those tests to try to understand, where you need to intervene, if you have multiple vessel disease, if you should talk with cardiac surgeons before. You can really have all those information before, be able to segment your patients and right away drive them to the right care area.
Yeah, it's more efficient too, because it sounds like you're seeing more patients, but it's also a more personal experience.
Yes. And the other thing too, something we need to keep in mind, it's kind of usually seen as a given, but staff are becoming shorter. You need to be able to rely on your equipment. We are making major investment within services in terms of technology, so we can provide preventive care also to our own equipment, so that we can do all this preventive maintenance, be able to intervene before the system is going to be done, and we are also investing a lot in our personnel. This is also very important. We want physicians to focus on their patients, not on the equipment, on other things. So that's also, a place that might not be that visible, where GE HealthCare has made a lot of investment to make sure that healthcare professionals can rely on, very reliable equipment.
Yeah, so. Definitely. All right. Charles Bruxelle, thank you so much, GE HealthCare, for joining us for this Heart Talk.
Thank you for having me.